Hello everyone, welcome back to my channel. If you are new here, welcome. If not, welcome back. This video we're going to be talking about dental office emergency terms. These terms here, of course, there are hundreds of terms that you need to know, but these terms here are the need to know and not just the nice to know, if you catch my drift. If you are going into dental hygiene school, if you're taking this class for the first time, these are terms that you need to know. Without further ado, let's get right into this video. Okay, here we go. First word, absence or petit mal. It says, generalized seizure of sudden onset characterized by a brief period of unconsciousness. Agonal breathing. Yeah, we're going to go back quick because in class, the professor doesn't care if you don't understand. If you don't understand, oh well, that's your bad. Figure it out on your own. So this video here is to make sure that at least the basic terms, whether it's the basics of the class, you're going to know. And as well, this will definitely help you during midterms and finals. Okay, back to the matter at hand. Periodic breathing, a struggle, periods of apnea, and deep rapid breathing. Aneurysm. Localized dilation of the wall of your blood vessel, aneurysm. Angina pectoris. Acute pain in the chest from decreased blood supply to the heart, angina pectoris. Angioedema. Swelling in the subcutaneous tissue or submucosa, symptom related to an allergy. Anoxia. Absence of oxygen in the tissues. Apnea. Temporary cessation of breathing or absence of spontaneous respiration. Arrhythmia. Variation from normal rhythm, especially the heartbeat. Ascites. Accumulation of fluid in the peritoneal cavity. Arrhythmia. Lipid deposition on the atma or lining of an artery. Aura. Warning sensation preceding a seizure. Bradycardia. Slowness of heartbeat less than 60 per minute. Cardiac arrest. Sudden stoppage of heart action, circulation ceases. Consciousness. Degree of awareness and or responsive to an external stimuli. Convulsion. Violent spasm. Cyanosis. Bluish discoloration of the skin and mucous membranes caused by a deficiency of oxygen in the blood. Defibrillation. Termination of atrial or ventricular fibrillation, usually accomplished by electric shock. Diaphoresis. Profuse perspiration or sweating. Dyspnea. Labored or difficult breathing. Edema. Abnormal accumulation of fluid in the interstitial spaces. Embolus. A floating blood clot, air bubble, clump of bacteria, or flat globule. Emesis. Vomiting. Erythema. Redness or inflammation of skin or mucous membranes. Glycemia. Presence of glucose in the blood. Hypernia. Abnormal increase in depth and rate of respiration. Hypoglycemia. Abnormally low level of glucose in the blood. Hypoxemia. Hyponemia. Hyponemia. Deficient oxygenation of the blood. Hypoxia. Inadequate or diminished availability of oxygen to blood tissues. Ictal. Pertaining to a sudden acute onset as in a stroke or epileptic seizure, infarct, localized area of necrosis, insulin, a hormone that enters the blood in response to a rise in concentration of blood glucose, ischemia, deficiency of blood supply, oxygen to a body part, ketoacidosis, too little insulin, accumulation of ketone bodies in the blood, Kussmaul breathing, low, slow, labored breathing. That's Kussmaul breathing. Lethargy, dullness, sleepiness, murmur, irregularity of heartbeat caused by turbulent flow of blood through a valve that has failed to close, murmur, occlusion, blockage, state of being closed, oral hypoglycemic agent, synthetic drug that lowers the blood sugar level, pallor, pale or ashen, paresthesia, abnormal sensations such as burning, prickling, or tingling, polydipsia, excessive thirst, polyphagia, excessive ingestion of food, polyuria, excessive excretion of urine, prodrome, premonitory symptom, a symptom indicating the onset of disease or condition, pruritus, itching, sclerosis, induration or hardening, seizure, transitory alteration in consciousness, motor activity, or sensory phenomenon or convulsion, stenosis, narrowing or constriction of an opening, stridor, vibrating sound during breathing, syncope, temporary loss of consciousness or fainting, tachycardia, abnormally rapid heart rate over 100 beats per minute, thrombus, a blood clot attached to the lining or intima of a blood vessel, tonic-clonic, which is a type of seizure, sudden sharp tonic contraction of muscles followed by a clonic convulsive moments. That's a type of seizure. Trellettenberg position. Patient is supine with heart higher than the head on a surface inclined downward about 45 degrees. Urticaria. Vascular reaction of the skin, hives, and elevated patches called wheals. Ventricular fibrillation, which is our last one. Arrhythmia without coordinated ventricular contraction, frequent cause of cardiac arrest. So these are the terms here that you guys need to know. Watch this video over and over again. Just know these terms because when the professor begins to explain chapter per chapter, at least you'll know what's going on with each chapter, with each patient that's going to be coming into the dental office. These terms are important because you don't know, nobody can plan, nobody knows when the emergency is going to happen, but at least you'll be well prepared, especially during this class. I wish you guys the best of luck. Study, study, study. You got this. Find out what works for you, and you guys will be fine. I wish you guys the best of luck. On that note, you have a good day. Thank you for watching all the way to the end. Don't forget to like, comment, and subscribe, and I will see you guys in the next video. Peace.